You are watching the Doc Talk Show.
This message is from the Ministry of Health with support from partners.
Welcome back to the third part of the Doc Talk Show. So in this third part, we are going to talk about management of these common colds and allergies, the conjunctivitis, as well as the complications that may arise if we do not manage these conditions. Thank you very much. Over to you, Dr. Alex.
Thank you. These allergies, normally when they come, they cause a lot of anxiety among mainly mothers who always take care of these children. And many are tempted to use certain things which are not recommended. The first thing I have to tell you is that whenever your child has any problems with eyes, be it allergy or something else, don't go anywhere else but first seek help from a qualified eye healthcare worker. And this one will be able to guide you through the treatment and tell you what to do. But for allergies, there are certain things you can do right from home. If the child is complaining of itching of the eyes, get a clean cloth, soak in cold water, and try to pass it over the eyes. That cold compress will relieve some of these irritations as you go for medical treatment in the hospital. Don't apply things like urine. Don't put any other medication because you may injure the child and eventually the child may lose the sight because of that irrational treatment. In the hospital, what we normally do, we use treatment that will stop further damage to the eye, or whether to ensure that the allergy is controlled. We have treatment that controls or stops the disintegration of the what we call the mast cells. And these mast cells, because when they disintegrate, they release histamines which can cause the itching and that other irritation causing the redness of the eye. So we give anti-mast cell stabilizers. We also give antihistamines to this child. These ones are in the form of eye drops, but sometimes if the child is able to swallow, we can give some like in the form of tablets or a syrup. Once those ones are given and those other cells the mast cells are not breaking down, because those irritation, the itching will go away, the inflammation will also subside, and the episode will also stop. Remember, this is a recurrent thing. If it happens again, don't think that the other previous treatment didn't work, so you must go to, maybe you go to another doctor or what. Just go back and they give you more treatment. But remember, self-treatment is not good, because you either give yourself an overdose, or you may treat something which is wrong. So those are that's what we normally use. Although some steroids can also be used for treatment. They are good anti-inflammatory agents, but they are not also good to be used for a long time, because people will use these steroid eye drops, and those ones are very dangerous to the eyes because they have the risk of raising the eye pressure. That's causing or a disease we call glaucoma. And that is a bad disease. It's a blinding disease. It causes irreversible blindness. Actually, it is the leading cause of irreversible blindness in the world. So you can only use those steroids under the guidance of a doctor, and usually it is for a very short period. Self-medication, I repeat it, avoid it because it will cause you trouble.
Thank you very much, Dr. Alex, for that very educative session. So I'm also going to talk about the management of these common colds and possible complications. So the common colds are the biggest cause of over-the-counter use drugs. Most parents will run to the pharmacy to buy any drug possible to treat their child with a cough and flu. However, we discourage that. First, I want to talk about the home remedies that you could use for your child, because knowing that they are at the biggest risk for contracting colds, we have some home remedies that can be used. So for children above 1 year, the honey that we all know, the simple honey, when they have just developed a cough, you can always give them a teaspoonful of honey in the morning and in the evening. But that is for children who are above 1 year. We discourage honey use in infants, in children below 1 year. Do not give them honey because it will cause them other complications. However, you can give to the older child. Then there are other home remedies that mothers know how to make. You could mix your lemon and still mix it with the honey, with the ginger, in moderate amounts. They could also help the child with the common cold. We emphasize that if your child has developed a common cold and they have fevers, please take them to the nearest health facility near you so they could be treated by a qualified medical person. But in case of an emergency, in the night you can't move and your child has developed a fever, you could use warm water. You do tepid sponging using lukewarm water. Avoid using cold water. Most parents would think because the baby's temperature, the body is high, the remedy is to use cold water. No, it is lukewarm water. So you mix your water to that temperature that you can touch, but it's lukewarm, that the baby can bathe. Put a cloth, preferably a cotton cloth, and tepid sponge. Tepid sponging meaning put it on the baby's body, like you press it on the baby's body, the whole body. So usually when we do this, it will help reduce the temperatures of the baby and expose them. So when you tap it sponge, leave them exposed. Don't let them put on heavy clothing. Maybe you can leave them in a vest and just shorts. We discourage use of medicines. However, there are these parents who have children who get what we call febrile convulsions. Usually, this child, it's common in children between 6 months and 6 years of age. When the child's temperature goes up, they will get a convulsion or a seizure, so which is quite dangerous, and some mothers are usually very scared of it, and it could also cause the child to aspirate or something. So we usually advise mothers whose children get febrile convulsions to have at least paracetamol syrup with them, or a rectal paracetamol. This is with prescription from the doctor, who, when you have it, you can insert it in case that the child has developed a temperature, do the tepid sponging, and then go to the health worker for further management. So what happens when this child is brought to hospital? We will run various tests on the child to see if this common cold is mainly still viral or it has proceeded to become bacterial. So we will do and also check the child physically. When we examine this child, we are looking out for other things that could be the child could be having. So we examine the child, do various tests, and prescribe accordingly. Kindly get all your medications from the health worker, prescribed from the health worker, and not over the counter. Thank you very much for staying with us. We come to the end of our third part of this program. We thank our sponsors, Ministry of Health and Camelin Men's Collection. When we come back, we'll be talking about complications and prevention of these diseases.
You are watching the Doc Talk Show.
This message is from the Ministry of Health with support from partners.